Hello, I'm Dr. Mark Majeski of Main Street Foot and Ankle Care. Today I'd like to speak about heel pain, otherwise known as heel spur syndrome, which consists of sometimes a plantar calcaneal spur and plantar fasciitis. Typically this is seen and felt by the patient as a pain in the morning when they first get up. The first few steps usually take it away. It can occur if you sit or drive your car and you get out of it quickly. Again, the pain will occur with the first few steps and then it goes away. Sometimes it can be precipitated by an injury such as a twisting motion. Sometimes runners can get this if they're increasing their mileage or intensity, or even have changed their shoe gear to a different brand. It's very prevalent in the middle-aged type patient population. We do see it in children, although it is less common, but mostly in the 50 and above age category is where we tend to start seeing this syndrome occur. Treatment and diagnosis can be made when the patient arrives at the office. We usually immediately take digital x-rays, which allow us to visualize the area, both soft tissue-wise and bone-wise, to determine if there is a small plantar calcaneal spur occurring. We also must differentiate either a tumor or stress fracture, which can also occur in this bone, and that will be done at the time that an x-ray is taken. Additionally, some syndromes such as rheumatoid arthritis, psoriatic arthritis, these can also mimic heel pain, and we must differentiate them from a plantar fasciitis type situation. Once we have diagnosed plantar fasciitis and we are sure that we are treating a heel spur syndrome, we tend to be very aggressive with this. With the first visit, if there are no contraindications after examining the patient and doing a thorough history and physical, we would like to perform injection of cortisone. This is given into the heel at the plantar aspect where it is most painful. Unfortunately, we would like to perform an injection. We usually perform a biomechanical strapping. We would like to fit the patient with a night splint to be worn every night while we are treating the syndrome. We would like to also prescribe a non-steroidal anti-inflammatory. We usually try to fit the patient with some type of insert. We have what we use are power steps. They're very close to custom inserts. If these work, the patient is ahead of the game. If they don't work, we certainly can fabricate a custom pair of inserts, which we are quite capable of doing in the office on a daily basis. We usually see the patient in 2 weeks. Reevaluate the patient at this time. If another injection is necessary, we will perform it. We continue the night splint, non-steroidal anti-inflammatory, sometimes limitation of activities, stretching exercises. These are all continued. The patient is reevaluated in another 2 weeks, and again, if injection is necessary, we do it. Typically, treatment for plantar fasciitis can take anywhere from 3 months to 6 months. It's not a very, very fast treatment. Very few people get better with the first or second treatment regime. It is a problem that should be treated. If you let it go, it can take up to a year and a half to resolve. Some resolve on their own, some do not. Chronic plantar fasciitis could require surgery. We try to avoid surgery at all time. We have a new technology that we like called ESWT, or extracorporeal shockwave therapy. This is a non-invasive type therapy. We have excellent cure rates with this. Again, it's non-invasive, no side effects. Downtime is minimal. When compared to surgery, no comparison. It is our treatment of choice, typically not covered by insurance, unfortunately, at this time, but that should not be a choice. If necessary and you can avoid surgery, you certainly should. So please call our office for a consultation at 732-349-0114, or go to our website for more information, mainstreetfoot.com. Thank you.